Hi, my name is Dr. Clive Gallagher. I'm a plastic and reconstructive surgeon with a special interest in gender affirmation surgery, and I practice here in Miami, Florida. And in this video, we're going to talk about some of the most common steps we do in labiaplasty, which follows vaginoplasty typically. So typically, certainly in my practice, when we do bottom surgery for trans feminine patients, we typically do it in 2 stages if we're creating the full vagina. And so that means that we'll do the first surgery, we'll make everything as natural and pretty as possible at the first surgery. And however, the patient needs to remember that most patients will want or need to do what's called a labiaplasty later down the line. I prefer personally to wait at least 6 months. Sometimes we do it sooner, just depending on what's going on. But usually I want most of that swelling to go down before we plan for labiaplasty. So there's a lot of confusion around the surgery, and understandably so, because labiaplasty is an umbrella term to describe a bunch of different techniques or maneuvers your surgeon may do depending on what you need. And so typically the most common thing we'll do at labiaplasty is create the labia majora, or bring them together in the midline, because with most techniques for vaginoplasty we can't do that at the first surgery. So usually we bring it together to give a more natural appearance of the labia majora, the labia on the outside, and to give some hooding to the clitoris as well. And in some patients that's all that they may need. Oftentimes as well, we're evening up some asymmetries. If there's some scar tissue there, we'll get rid of that. And typically we're addressing some functional problems as well. For example, if the urethra, or where you pee from, is off to one side, or we're still getting a lot of spraying, we can address that. Or if we have narrowing at the entrance or scar tissue at the entrance of the vagina, we may be opening that up. Or even if we're dealing with vaginal stenosis, oftentimes we'll deal with that at the same time as the labiaplasty. So there's a range of different things we can be treating, and specifically addressing some other things. For example, oftentimes I'll see patients come with, they get swelling at the time of arousal, and so that might be that some of the old erectile tissue was left behind. Maybe we're not happy with the size of the clitoris. Clitoral reduction is fairly common as well at the time of this procedure. Like I said, usually most of our patients, we want to wait at least 6 months for this to do. Sometimes we're working with deductibles and we're on the clock from that point of view. Gender affirmation surgery is expensive, and oftentimes we don't want to have a patient have to do a full deductible again, so sometimes we can work with that. And like I said, sometimes if we're having issues such as narrowing of the vagina, narrowing or problems with where you pee from, the urethra, we may want to address those sooner. And typically in most of my patients, if we need to address something like that, we can do the labiaplasty at the same time, so they're not getting an extra surgery, but we may be doing it a little bit sooner than expected. So always plan, if you're planning for bottom surgery, it's a complex procedure. If your surgeon does one stage, great, but just know that even if they do one stage, a lot of patients are going to want to do a second stage in the future. And certainly in my practice, we say it's a 2-stage procedure, and to expect that you're going to want to do another procedure later on.